Can we have the timer, please?
And the slides.
Start. Good afternoon, everyone. My study is effect of pulse dose oral azithromycin in management of meibomian gland dysfunction. According to the international workshop, meibomian gland dysfunction is defined as a chronic diffuse abnormality of the meibomian gland which is characterized by terminal duct obstruction or qualitative or quantitative changes in the glandular secretion. And this leads to tear film abnormalities due to evaporative dry eye, ocular surface irritation, and clinically apparent inflammation. Meibomian gland dysfunction is a common clinical condition but is an underdiagnosed and undertreated disease. And the prevalence increases with age due to alteration in the lipid with age. And the conventional management includes lid hygiene, warm compression, lid massage, and antibiotic steroids, and other antibiotics like tetracyclines. In our study, we used azithromycin, which is a broad spectrum macrolide antibiotic with a long half-life and high degree of tissue penetration. And it has anti-inflammatory and lipid regulating effect. So the objective of our study is to determine the effect of pulse dose azithromycin in patients with refractory MGD. Ours was a hospital-based prospective interventional study conducted on 33 patients with refractory MGD. To them, we administered oral azithromycin 1 gram once a week for 3 weeks, and follow-up was done at 3 weeks. And to all of them, we had advised them to continue the topical medications which they were already on. And we assessed their subjective symptoms as well as plugging and vascularity of lid margin, tear film breakup time, corneal conjunctival fluorescent staining score, and Schirmer test value before and after treatment. We included patients with refractory MGD and excluded patients who were already on other oral antibiotics like tetracyclines. These are the slit lamp photograph of our patients showing plugging of meibomian gland and foamy discharge. In our study, majority of patients belong to the 6th decade with mean age of presentation of 61 years with male preponderance. And out of 33 patients, 21 patients showed symptomatic improvement at 3 weeks. Also, there was statistically significant improvement which was noted in tear film breakup time, which was P.02, Schirmer test value, as well as conjunctival corneal surface staining. So, in majority of patients, there was improvement in symptoms following administration of pulse dose of oral azithromycin. Also, no adverse events were reported by any of the subjects, and they were compliant with the pulse dose regimen. Similar study which was conducted by Green et al. In Department of Ophthalmology, California, showed similar results. Also, study conducted by Upapong et al. Showed that oral azithromycin had equal efficacy and fewer gastrointestinal adverse effects than oral doxycycline in MGD management. And study conducted by Kashkoli et al. Also showed that there was with oral azithromycin there was betterment of clinical response, better effect in improving signs, and shorter duration of treatment than oral doxycycline. So from our study we concluded that oral azithromycin pulse dose therapy for 3 weeks was found to be effective in management of MGD with short-term treatment and fewer side effects. Thank you. These are my references.
Thanks, Raji. Some problem with the mic. Are you able to hear me?
Yes, ma'am.
Okay, so I have a couple of questions for you. Yes. First is you mentioned what was the staining grade that you used? What was the staining scoring system that you used in your study? You said there was a improvement in scores. So what was
You mean the question?
which staining, which scores?
Fluorescent staining.
No, what was the staining, what was the method that you followed? I understand with fluorescein you will do with a yellow light, yellow filter, but which grading did you follow? Whether was it a National Eye Institute grade?
Oxford.
Oxford, that you have to mention,
Okay,
right?
ma'am. Yes,
And symptomatic, what do you mean by symptomatic improvement?
Like patients, like we.
How did you
assess
grade it? How
with the
did you?
questionnaire, ma'am.
Speed question.
Speed questionnaire, ma'am.
Speed questionnaire. Okay. And there were two photos where you had shown A and B. So are they are these already published?
No, ma'am.
So A and B, you have to put the legends. If you are doing A, B, then you have to put the legends, what it means. Okay, those Frothy secretions, so you have to put those legends.
Yes, ma'am.
Thank you.
Thank you, ma'am.